The overhead lights in operating room 4 buzzed white and cold, and the first thing Dr. Marcus Whitfield saw when he looked up from the instrument tray was a face he didn't recognize standing at the edge of his sterile field. "Who let this nurse into my OR?" His voice cut through the low hum of monitors, sharp enough that the anesthesiologist flinched. The woman standing near the head of the table didn't flinch. She was maybe 5'6", dark hair pulled back tight under her surgical cap. Gloved hands already positioned at the patient's abdomen like she'd been there before he'd even noticed her. "She's covering for Denise," the circulating nurse said quickly. "Dennis called in 20 minutes ago. Food poisoning. We didn't have anyone else certified for." "I don't care if she's certified to fly the space shuttle," Whitfield snapped. "I don't know her. I don't know her hands. This is a ruptured spleen with active bleeding, not a training exercise." He looked at the woman directly now, taking in her calm eyes, the stillness in the way she held herself. "What is she doing in my surgery?" The woman met his gaze without blinking. "My name is Sarah Voss," she said evenly. "I'm a trauma RN, 12 years experience. I've assisted over 400 abdominal surgeries. And your patient's pressure just dropped 6 points in the last 90 seconds. Doctor, so with respect, we might want to have this conversation after we stop the bleeding." For one suspended second, nobody in the room breathed. Whitfield's jaw tightened. "Get her out," he said. Now. That was the moment. That was where it started. My name doesn't matter for this story. I was the scrub tech standing 3 feet away, close enough to see Sarah Voss's hands never once shake. Close enough to hear every word that followed. What happened over the next 4 hours in that hospital would end with 2 Navy SEALs walking through the ICU doors in full kit and Dr. Marcus Whitfield, a man who had built his entire career on being the smartest person in any room, would learn that sometimes the quietest person in the room is the one who has already survived things he couldn't imagine. But to understand how we got there, you have to understand who Marcus Whitfield was and why a woman he'd never met made him angry enough to try to throw her out of his own operating room. Bayview Regional Medical Center wasn't a small hospital, but it wasn't Johns Hopkins either. It was the kind of place that served a mid-sized city and the rural counties around it, which meant on any given night you might get a car accident, a farming injury, a gunshot wound, and a heart attack all showing up within the same hour. Whitfield had been the chief of trauma surgery there for 11 years. He was good. Genuinely good. The kind of surgeon whose hands moved like he was having a conversation with the tissue in front of him. Calm and precise even when the monitors were screaming. But 3 years earlier, Whitfield had lost a patient, a 24-year-old motorcyclist with a lacerated liver. The float nurse assigned to assist that night had frozen during a critical moment. Hesitated just long enough handing him a clamp that the patient bled out on the table. It wasn't entirely her fault. She'd been pulled from a med-surg floor with barely any trauma experience. Thrown into a situation she wasn't prepared for. But Whitfield had been the one holding the young man's liver in his hands when he died. And he had never forgotten the feeling of watching a life end because the system had put an unprepared person next to him at the worst possible moment. Since then, Whitfield had become fiercely, almost obsessively protective of who touched his operating room. He vetted every nurse. He memorized names, credentials, track records. He ran his OR like a closed circle. And strangers, especially strangers who showed up unannounced during an emergency, triggered something in him that went beyond professional caution. It was fear wearing the mask of arrogance. He would have told you, if you'd asked him that night, that he was protecting his patient. And in his mind, that was completely true. He just didn't know yet who Sarah Voss really was. "Doctor," Sarah said again, her voice level. "Pressure still dropping. We don't have time for you to call HR." I said, "Get her out." Whitfield repeated, louder now, looking past her to the circulating nurse. "Find someone else. Anyone else. There is no one else," the circulating nurse said, her voice tight with panic. "It's a Friday night. We've got 2 other traumas in the department, and she's the only certified OR nurse on the floor right now." Whitfield's eyes flicked back to Sarah. There was a beat, just a flicker, where something like doubt crossed his face. Then it hardened again. "Fine," he said through his teeth. "But you do exactly what I say, when I say it. Nothing more. You're a pair of hands tonight, not a nurse." "Understood? Understood?" Sarah said, and picked up the retractor without another word. For the first 20 minutes, it went the way Whitfield expected. Tense, silent, efficient. Sarah anticipated his instruments before he asked for them, which should have reassured him, but instead it seemed to irritate him further, as if her competence was somehow an insult to his caution. When he called for a hemostat, it was already in her hand. When he shifted his stance to get better access to the bleed, she adjusted the retraction without being told. "Stop doing that," he muttered. "Doing what?" Anticipating. "I don't need you thinking. I need you following instructions." "Yes, doctor," Sarah said, and didn't stop anticipating, because stopping would have meant letting the patient bleed longer than necessary, and that wasn't something she was willing to do to satisfy a man's pride. They got the spleen controlled. The patient stabilized. It should have ended there. A rough encounter between a nervous surgeon and a skilled fill-in nurse, forgotten by morning. But that was the moment the first call came through on the overhead system, the one that turned a difficult night into something else entirely. Mass casualty incident inbound, multi-vehicle collision on Route 9, estimated 12 to 15 patients, ETA 8 minutes. Whitfield's head snapped up. 15 patients, he repeated. On a night we're already down 2 nurses and 1 surgeon short. "I can stay," Sarah said immediately. "I didn't ask you to stay. You're going to need every set of hands you can get in the next 20 minutes, doctor." "I'm staying." She was already stripping off her gloves to help prep the trauma bay, moving with a kind of brisk, contained urgency that made it clear this wasn't the first mass casualty event she'd ever walked into. Whitfield didn't argue. There wasn't time. What followed was the kind of controlled chaos that defines emergency medicine at its worst and best. Gurneys rolling through double doors in rapid succession, the overhead system calling out incoming traumas faster than rooms could be assigned, staff moving in the particular urgent shorthand that develops among people who've done this before. And in the middle of it, something began to happen that Whitfield couldn't ignore, no matter how hard he tried. Sarah Voss was better in a crisis than almost anyone he'd ever worked with. The first sign came when a 16-year-old girl was wheeled in with a crushed pelvis and rapidly dropping blood pressure, surrounded by 3 panicking residents who couldn't agree on which line to establish first. Sarah moved past them, found a vein in the girl's neck in under 30 seconds, and had a central line running before the attending even reached the bed. "Where did you learn to do that?" the attending asked, stunned. "Somewhere loud," Sarah said, already moving to the next bed. The second sign came 20 minutes later, when the hospital's backup generator flickered and dropped for 11 seconds during a partial power failure. 11 seconds where every monitor in the trauma bay went dark and half the staff froze, uncertain what to do without their screens telling them vital signs. Sarah didn't freeze. She was already at the bedside of a man with a chest tube. 2 fingers on his carotid pulse, counting out loud, calling his heart rate and rhythm from memory and touch alone until the power kicked back on. "How did you know to do that?" a nurse asked her afterward, breathless. "You learn to read a patient without a machine telling you what they're feeling," Sarah said simply. "Machines aren't always there when you need them." Whitfield overheard that. He didn't say anything, but he noticed it, filed it away in the part of his mind that was, despite his best efforts, becoming increasingly curious about who exactly this woman was. The third sign, the one that finally cracked something open in him, came an hour later in the ICU with a patient named Daniel Reyes. Reyes was 19, one of the crash victims, and he'd come out of surgery with internal bleeding that the team thought they'd controlled. He hadn't been assigned to Whitfield directly. A colleague, Dr. Patterson, had done that surgery. But when Reyes suddenly crashed in recovery, blood pressure collapsing, oxygen saturation plummeting, Whitfield was the closest surgeon, and he ran into the room along with everyone else on the floor, including Sarah. "Has bleeding somewhere we missed," Whitfield said, scanning the monitors, his mind racing through possibilities. "Get me imaging." "Get me." "There's no time for imaging," Sarah said, already at the bedside, her hands moving over the young man's abdomen with a precision that stopped Whitfield mid-sentence. "Feel here. It's distended. It's tense. It's a slow bleed that just became a fast one. We need to get him back to the OR right now, or he's not going to make it to imaging." "You don't make that call," Whitfield said. But even as the words left his mouth, he was already feeling what she was feeling, and his own instincts were screaming the same thing. "I'm not making the call, doctor. I'm telling you what I feel and what the monitors are showing and what the last 4 minutes of his vitals look like on a trend line. You're the one who makes the call, but you need to make it now." Something in her tone, not disrespectful, but absolutely certain. The voice of someone who had made split, second life, and death judgments before and trusted her own hands completely, made Whitfield stop arguing. He looked at Reyes's abdomen, pressed his own fingers against the same spot Sarah had indicated, and felt the tension she was describing. "OR2, he barked. "Now, move." They got Reyes back into surgery in under 4 minutes. Whitfield found a bleeding vessel that had been missed in the first surgery. Small, easily overlooked. Exactly the kind of injury that becomes catastrophic if it's not caught in time. If they'd waited for imaging, if they'd waited even 10 more minutes, Daniel Reyes would have died in that recovery room. Sarah had been right, not lucky. Right? In the specific way that only comes from experience doing this exact thing, under exactly this kind of pressure, many times before. When the surgery was over and Reyes was stable, Whitfield stripped off his gloves in the scrub room and stood there for a long moment, staring at his own hands, replaying the night. Sarah came in behind him to wash up, saying nothing, moving with the same quiet efficiency she'd shown all night. "Who are you?" Whitfield finally asked. His voice had lost its earlier edge. It sounded, for the first time that night, like a genuine question. "I told you. Sarah Voss. Trauma nurse." "That's not what I'm asking." He turned to face her. "I've worked with trauma nurses for 20 years. I've never seen anyone rate a patient the way you read Reyes. I've never seen anyone find a central line that fast in a crashing pediatric patient. I've never seen anyone count a pulse out loud through a total power failure like it was nothing. He paused. Where did you learn to do the things you did tonight? Sarah dried her hands slowly, considering the question. Or perhaps considering how much of the answer she was willing to give. Before I was a civilian trauma nurse, she said. I was a Navy Hospital Corpsman, first class. I spent 6 years attached to a Naval Special Warfare unit as their medic. She looked at him steadily. I've done trauma care in places with no power, no imaging, no backup, and bullets still coming in. A crashing patient in a well-lit hospital with a working generator is not the hardest thing I've ever had to manage, doctor. It's just the one you happen to be standing next to tonight. The Whitfield stared at her. The pieces were rearranging themselves rapidly in his mind. The central line under pressure, the pulse count during the blackout, the calm, unshaking certainty in the recovery room. It all made a terrible, humbling kind of sense. You were a corpsman, he repeated slowly. Attached to SEALs. For 6 years, Sarah said. I was the only medical support some of those men had for hours at a time, in places you've never heard of, doing things I'm not able to talk about in detail. I've done field surgery in the dark. I've kept men alive with what fit in a single pack, carried on my back, miles from any hospital. She held his gaze. So, when I tell you a patient's abdomen feels wrong, doctor, I'm not guessing. I've felt that exact wrongness before, and it was never wrong. It was at that exact moment, as Whitfield stood absorbing what he'd just learned, feeling something between shame and awe settling into his chest, that the ICU doors down the hall banged open. 2 men walked in wearing combat fatigues that had clearly come straight from a flight, dust still on their boots. Faces set with the particular urgency of men who had traveled a long way in a short time. They moved through the corridor with a controlled, purposeful speed that immediately drew the attention of every staff member on the floor. Security started toward them, but the taller of the 2 men held up a hand, not aggressively, just with the absolute confidence of someone used to being obeyed without needing to raise his voice. We're looking for a patient, he said. Daniel Reyes. Word is he crashed tonight and someone saved his life. Whitfield stepped forward, still in his scrub cap, bewildered. Who exactly are you? The second man's eyes moved past Whitfield and landed on Sarah, standing in the doorway of the scrub room. Something shifted in his expression immediately. Recognition, then something closer to relief. Doc, he said. It's you. Sarah's composure, steady all night through every crisis, finally cracked into something warmer. Ramirez, she said. What are you doing here? Rise is my sister's kid, the man said. Soon as we heard he'd been in a crash and things went bad in recovery. Half the team wanted to fly out. Command let 2 of us go. He looked at her, shaking his head slowly, like he still couldn't quite believe it. Of course it was you working tonight. Of course it was. Whitfield looked between them, utterly lost. You 2 know each other. The taller man, the one who'd spoken first. Call sign later revealed as Anchor, a team leader with Naval Special Warfare Group 2. Turned to Whitfield with an expression that was somewhere between disbelief and something close to reverence. You don't know who this is? He asked. I know she's a former Navy corpsman, Whitfield said carefully. Anchor let out a short, humorless laugh. She's not just a former corpsman, Doc. She's the reason 4 of the guys on my old team are alive right now. There was an operation. I can't give you details, but I can tell you it went bad, fast, in a place with no support for hours. She kept 2 men alive with collapsed lungs using gear she improvised on the spot. She did a cricothyrotomy in the dark, by feel, on a teammate who'd stopped breathing, using a knife and a pen casing because that's what she had. He shook his head again. There's a reason every operator who ever worked with her calls her steady. Because in 6 years under fire, in the worst conditions you can imagine, her hands never once shook, not once. The ICU had gone quiet. Nurses, residents, even the security guards who'd started toward the 2 SEALs had stopped and were listening now. The weight of what was being said settling over the corridor. Whitfield felt something cold move through his chest. The specific, humbling cold of a man realizing exactly how wrong he had been and how loudly he had been wrong. She saved 4 men on a mission I can't talk about. Anchor continued, quieter now, looking at Whitfield directly. And tonight, from what I understand, she caught something in your patient that would have killed him if she hadn't. That's not luck, Doc. That's 12 years of training on top of 6 years of combat medicine. That's someone who has done more to keep people alive than most of us will ever fully understand. Ramirez had moved to Reyes's bedside, gently touching his nephew's hand, his jaw tight with emotion he wasn't quite hiding. "Thank you," he said quietly to Sarah, not looking up. "For all of it. Not just tonight." Whitfield stood in the doorway of the ICU, still holding his surgical cap in one hand. And for the first time all night, he had absolutely nothing to say. It took him a long moment to find his voice, and when he did, it came out smaller than he expected. "I told you to get out of my OR," he said to Sarah. It wasn't a question. It was an admission. "You did," Sarah said, without malice. "I called you a pair of hands. I told you not to think." He shook his head slowly, the memory of his own words now sitting heavy and ugly in his chest. "I had no idea what you'd already survived, what you'd already done to save people, in situations most of us will never come close to understanding." "You were protecting your patient," Sarah said. "I understand that." "No," Whitfield said, and there was real weight in it now. Something breaking open in him that had been closed for 3 years. "I was protecting myself. I lost someone on that table 3 years ago because I trusted a nurse who wasn't ready, and I've spent every day since then terrified of it happening again. Tonight, I let that fear make me treat you like you were the danger in the room, when you were the only reason half of these patients are still breathing." He looked at her, and for the first time that night, his eyes were unguarded. "I'm sorry. Genuinely, not because of who you turned out to be. I should have trusted your hands the moment I saw them working, before I knew anything about your record." Sarah studied him for a moment, and something in her expression softened. "Most people don't say that part out loud," she said. "The part about it being fear, not arrogance." It was both, Whitfield admitted, but the fear came first. He extended his hand, and this time it wasn't a doctor addressing a subordinate. It was one professional recognizing another, finally, fully, without reservation. "Thank you," he said, "for Reyes, for tonight, for staying even after I tried to throw you out." Sarah shook his hand. "You were doing your job, Doctor, badly for about 20 minutes, but you got there." A small, surprised laugh escaped him, the first real one of the night. "I did," he said. Eventually, Anchor, watching the exchange, allowed himself a small nod of approval before his expression turned serious again. "We can't stay long," he said, "but I wanted Doc to know we came the second we heard. And I wanted whoever was in charge here to know exactly who they had working their floor tonight." He glanced at Whitfield. Sometimes the most dangerous person in the room is the one nobody bothered to ask about. Whitfield nodded slowly, the words settling into him with the particular weight of something he suspected he'd remember for a long time. "I won't make that mistake again," he said. "Not with her, not with anyone." Over the following weeks, something changed in Bayview's trauma department, and it started with Marcus Whitfield. He requested Sarah Voss by name for every major trauma case that came through, no longer as the last resort fill-in nurse, but as the professional he now understood her to be. He began asking new staff about their backgrounds before he judged their capabilities. A small but deliberate shift that several people noticed without him ever explaining why. And in the surgeon's lounge, when a resident once made a dismissive comment about a nurse he didn't recognize covering a shift, Whitfield stopped him cold. "You don't know what that person has survived," he said. "You don't know what rooms they've kept people alive in before this one. Judge the hands, not the face you don't recognize." Daniel Reyes recovered fully. He came back to the hospital months later, walking on his own, to personally thank the woman who had insisted on getting him back to surgery when everyone else was still waiting on imaging. Sarah hugged him briefly, told him to take care of himself, and went back to her shift without ceremony, the way she did most things. She never asked for recognition. She never brought up her service unless someone asked directly, and even then, she offered only what she was willing to share. But those who worked beside her long enough came to understand something simple and enduring about Sarah Voss, the quietest, steadiest hands in the room often belong to the person who has already stood in the worst rooms imaginable and walked out the other side carrying everyone she could. Today, Sarah still works trauma nursing at Bayview, though she's since been made lead trauma coordinator, training new staff in exactly the kind of composure under pressure that once made a room full of doctors doubt her before they'd even seen her work. She keeps a small, unremarkable patch from her old unit pinned inside her locker, not for show, just as a quiet reminder of where her steadiness came from. And somewhere, in a hallway that still remembers the night 2 SEALs walked in wearing dust from another continent, there's a story the staff still tell new hires about the night a doctor sneered, "What is she doing in my surgery?" and by morning, understood exactly what she had always been doing quietly, competently, saving lives in rooms far harder than his own.